I'm excited to welcome to the program Rural Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is, should I take Tylenol during pregnancy? What is the generic name of Tylenol?
Well, depends on where you live, but in the United States, it's acetaminophen. But if you're in Europe, particularly England, it's paracetamol. And there are lots of brand names. It's Mapap, Feverol, children's acetaminophen, Aciphen. So lots of different ways that people can buy Tylenol.
Is Tylenol safe to take during pregnancy?
Well, yes and no. There's some new evidence anyway that says maybe we should rethink it. But ACOG, that is the American College of OBGYN, says take it, but take it for as short a time as possible and for this lowest dose possible. So they're kind of in the middle, but that's, I guess, where they like to be.
What are the risks of taking Tylenol?
Well, there are a few. The big problem with Tylenol is that there's a very small difference between the therapeutic and the toxic dose. So it's really easy to overdose. The other problem with Tylenol or acetaminophen is that it's not a very good pain relief.
What is the daily dose of Tylenol?
So it depends on, but you should not exceed 1,000 milligrams per dose, and you should not exceed 4,000 milligrams per day. That is if you are an adult weighing over 110 pounds. However, in the nursing home, they say not more than 3,000 milligrams or 3 grams per day. I think that for older people like myself, 2,000 milligrams or 2 1,000 milligram tablets a day should be the maximum dose.
Which is the better pain relief, Tylenol or aspirin, or the aspirin family?
Well, Tylenol is not a good pain reliever, but the aspirin family, that includes many things. Ibuprofen, which is the generic name for Motrin. There's Advil, there's Naproxen, there's Naproxen. But these medications work much better to relieve pain than Tylenol does. However, putting the two together is not a bad idea. You know, we were told to do that back when I was an orderly back in 1971. Give Tylenol and Motrin together. Very good pain relief, almost as good, and some people say as good as a narcotic like oxycodone.
Is Tylenol safe in pregnancy?
Well, it depends on who you ask. Again, ACOG is very careful, and they say take as little as possible for as short a time as possible. But there are some new studies out and they have looked at children that are 3 years old. The problem with these studies is that it takes 15 months for a baby's brain to develop, and they could be taking Tylenol after they're born. So it's really hard to know whether there's any side effects. But if you look at the studies, they say ADHD and sleep problems are among the things you see with Tylenol use, but you don't know exactly how long those people have used Tylenol. It could be that they've had headaches throughout pregnancy and have used it for 3 months. You don't know.
All right, the best place to go is ruraldocalan.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Rural Doc Alan podcast, guys. Take care.